Hey guys, welcome back to another episode of Cell Talk. This is your host Christian. I have our social media manager Juliana with us, and then our rep for our stem cells, Rick. Rick, tell us a little bit about yourself. Give us some history. Where are you from? What do you do? That type of stuff.
Oh, absolutely. Thank you, Christian.
Mm-hmm.
And by the way, thank you for having me.
Absolutely.
I go back, because of my age, to get into healthcare. I was an orthopedic implant distributor, but started out in the field in 1984.
Okay.
And then I was bought out in 2004, and then I went into the human allograft business and became, developed an expertise in osteoinductive pace, osteoconductive pace, and I used to train spine guys that would sell them throughout the areas through a few states. And so that's where I started to develop a great interest into regenerative medicine.
Okay.
And then about 10 years ago, I really started to get into regenerative medicine knowing it's the future. And the nice part about it is when you're in regenerative medicine, you're trying to get rid of, and I'll go into different examples of different products, but we're trying to get rid of the inflammation and we're trying to fix the problem. Whereas doctors, orthopedic surgeons, and other doctors in the field, they've been trained on the cortisone era. They want to kill the inflammation, but what they want to do is they kill the cells going with it. And there's no regenerative aspect of that.
Right.
So what the new age and what we're trying to train people is we want to down-regulate with exosomes your inflammation, and then we want to communicate to your cells to, instead of be dormant as you get older, to wake them up to go do what they should do. And that is what an exosome does. So we're trying to recruit your cells to do what they should do.
Yeah.
Versus kill them and kill the inflammation like they had done in past years with the cortisone eras.
Yeah, and we notice a lot of, with our patients here, we're giving infusions of exosomes, then we're doing the direct ortho injections with stem cells following that. So we kind of...
Combination.
Yeah, it's a good combination. It's very potent. We kind of refer to the exosomes as like the worker bees, basically, so that the stem cells can go to work and target that inflammation and then rejuvenate and bring in those new cells.
You guys are Palm Beach Stem Cell is doing it the right way. Patients have to be a little more patient with it, but because like Gary Brecka,
No pun intended.
Oh, yeah, that's right. and like Gary Brecka actually gives a good analogy on his show, and I've been explaining this for years. Mm-hmm. If you take the difference between a stem cell and an exosome, there's a big difference. But they all do different signaling, okay? But if you have inflammation, which most people have in their body, you can take, and let's say you call the fire department, and your front doors are made out of steel, 6 inches thick. Well, no one can get in. The fire department can't get in. That's the same thing if you have a stem cell and they see inflammation, it doesn't know how to signal it. It doesn't know how to react. So it'll go right by it. Versus if you have an exosome, the exosome will go right through the door. It'll down-regulate the cytokines causing the inflammation, and it'll recruit your cells to let's go do what we should do. And plus it delivers all the growth factors and all the goodies. And that's the difference between an exosome and a stem cell.
Yeah.
I mean, they both have a place, but the one who is the future will be the exosome.
Yeah, it can break that blood-brain barrier.
Exactly, and it's real simple. I get one probably every 2 months, and I feel great with all my, at 67, my spinal arthritis issues, my knees, and I get a simple, painless IV, push IV, which takes 3 minutes.
Yep.
And I have noticed a world of difference, whether it's skin, hair. We're actually having clinics where they do an IV first, and if someone gets in for surgery, they heal quicker.
Yeah, we've talked to a few patients that have thought about doing surgeries, or they can't get away from that surgical aspect of doing the pre-surgical protocol, which, I mean, there's different protocols for everything. So that pre-surgical and kind of get in, boost that immunity, boost the possible chance of decreased healing time, scar tissue.
Exactly.
That's there because sadly the one thing we can't fix is scar tissue. So it's better to get it first, and then once you get done with the surgery, come back and see us again, and we can get that second round of treatment in, which is only a benefit.
The beauty of using the exosome and the company that is the world leader, the way their cells cause the healing, it's more an elongated style. Mm-hmm. So people that want to take down scars and reduce them, or to prevent scarring when healing, their product is the best. And what they did many years ago, it's safe. It's not a multi-donor product, because we all realize that from one C-section mother, from her tissue, is going to vary from another mother's. So with this, they took a single source placenta in 19, and what they're able to do is culture expand it. And they know by adding amino acids motivates the exosomes. The other part is, and the reason why they take the single source placenta is because it hasn't received the command yet. So it can go and, like Christian pointed out, go up through the blood-brain barrier, which we've had studies out in California, which shows it through ultrasound, and it'll go after that inflammation and find it. That's why we tell everybody, get off your NSAIDs for a couple days before. We don't want the inflammation disguised. We want them to find it. So they've really made this product to be the most anti-inflammatory product out there. Yeah. And that's the beauty of taking a exosome that hasn't received a signal yet. That's the problem with, say, amniotic fluid. Does it have some exosomes? It has a few, not to the technology and the product of what MSCs have or what Chimera's products have, whether they're topically used, etc. But we have seen, people with pain aesthetically just heal and get rid of the redness after a laser within 2 days. We've seen all the above happen, so we know the inflammation goes right away. So certainly less scarring. I would think down the road, I know they're going to have 4 INDs going. They were approved to the second stage of the Clovit long hauler, and that was use of IV. So by having this single donor product that they are able to have the technology to make, the beauty is the safety is fantastic, because they know it's made to pharmaceutical injectable standards. They know the product is the same every time it goes out. Yeah. You don't take a chance of someone missing a test or a multi-donor tissue product. Yeah. So safety means everything. Results certainly do too.
I think that's the fun of the infusion too, because it's like, I mean, if for people that do have injuries and stuff like that, it's gonna reach those spots. But for the people that are doing it for their general wellness and stuff like that, I think that's the fun aspect of like, oh, what else is it gonna cure?
It's like,
I mean,
overall.
Yeah, exactly. Yeah. Like some patients report, I came in, I wanted infusion because my knee was bugging me this week, and then they were like, oh man, my shoulders feels really good. Yeah, something else they know, or like very clear-minded, or like their vision was clear. It's just like you never know for the general well-being aspect. You never know exactly like what benefit.
Like power up.
Yeah, exactly. It is. It's like you play Mario, you get the mushroom, you get a little boost, boop, boop, boop. Exactly, stuff like that.
We've also we have had. I had a doctor, and two accounts, and this doctor had the long hauler, and so he ended up we gave him a sample, whether you nebulize it or IV it, and he said he went to his eye doctor and his eyesight got better. Wow. That was within 2 days, and then it took 5 days, and his long hauler had disappeared, had gone away. So those are the things that we see. Also have a doctor who was head of anesthesia at Jupiter Hospital, and his dad was 80, spinal stenosis, and within 5 days I got an email back, or text, that said his shakes went away, and he's playing golf without pain.
Wow.
So people that had tremors and all these other and inflammation, which we know is very bad, is the root to a lot of evil.
Yes.
We are seeing great results by taming that inflammation down, and just like Palm Beach stem cell, it isn't a one. It isn't, let's say, a one size fits all. There are different applications. So if you're injecting a joint, there's some nice things about using a Wharton's jelly or a flow product. There's also, like we say, go after that inflammation first so they can work on the joint. They're not going to go try and go to the inflammation, but then when they get there, they don't know what to do with it. So by doing what you're doing, you're able to isolate right on the problem by going after the inflammation, because people that have knee pain, shoulder pain, back pain, they don't have inflammation just in those areas.
No.
They have it in many other areas of their bodies.
Widespread.
Yeah, I feel for your on the brain tumor aspect, but trigeminal neuralgia, I had a really bad flare-up when I was in undergrad, and just even laying my head on a pillow was like 20 out of 10 pain.
Wow.
And I would like, if we were talking, this side of my face was like paralysis, and my eye would water and everything. So I went to the ER, and they were like, oh, you're probably grinding your teeth at night. So I wore the mouth guard, nothing fixed, and then next thing you know, they just prescribed muscle relaxers, which, I mean, helped you sleep, but it doesn't fix anything.
No, it's a Band-Aid,
Yeah, exactly. So I would imagine on the trigeminal neuralgia part that exosomes or direct injection would attack it.
Well, well, you know, and the other thing I think would work well, and you're exactly right, there will be, for dementia and Alzheimer's, there will be a delivery system that'll take those exosomes right up there.
Yeah.
They're not, they're not there. I mean, I think the product's there, but obviously there needs to be
studies,
more studies. But I do believe that there's some exciting things out there. The other thing that exosomes work very well with, and Tony Robbins swears Dr. Harsh out of New Orleans is his doctor, but he does the exosomes, and he does hyperbaric bed, and I believe he has one at his house. Dr. Harsh told me. I think he said he has one on his plane. But for your boyfriends, I have customers that when they get people in the hyperbaric, because cancer cells can't live on 100% pure oxygen. So they get them, and they've actually seen the cancer either shrink or sometimes disappear, but it's never moved forward. So if anyone else using a hyperbaric bed in conjunction with exosomes is fantastic. Now, I don't know that they used exosomes with that, but these places used the hyperbaric on their patients, and it seems to have a very good response in treating cancer, the hyperbaric beds, just by themselves. Okay.
Hyperbaric chambers are great. I mean, a lot of athletes are using them. I've done one, and it's just a very refreshing feeling.
How does it work?
Basically, like you said, it takes the oxygen, and it's 100% oxygen. You're in a tube that's literally, if you do a full body one, it's 100% oxygen.
Yeah.
Another good, I wouldn't say alternative, but a good addition to exosomes and stem cells is ozone therapy. That's a big one.
Methylene blue. A lot of cancer patients, if we're talking cancer, they're not getting the oxygen to their blood, and there's a lot of other people that aren't. As they get older, they don't get the oxygen. Well, that's what methylene blue does.
So I have a lot of methylene blue. We have that as well.
Yeah, and I actually didn't know that, but
I'll post about it tomorrow.
I walked into a renowned regenerative medicine clinic in Miami. They're customers, and I walked in, and he's sitting there while he's talking to me, and he's getting his methylene blue injection, and he thinks the world of it.
Yeah.
And he's not that old of a guy.
Yeah.
But that's how I learned about it, and here it is, that there's a lot of illnesses where you're not getting the oxygen that you want into your blood. So.
Yeah, I mean, I'd love to try everything at least once, just so you can make it better to talk about it. That's one thing I haven't tried. We kind of redid our peptide list, because we have access to all the peptides as well. That was a big one on there. I mean, the FDA wants to pick and choose which ones you're allowed to buy, but luckily that's one that's on that list.
Well, the FDA, before they moved it before they downclass, or let's say upclassed it and put it on, let's say, the serious or dangerous list or risky list, the peptides. Meanwhile, like BPC 157, your body produces it. It comes, I think 17 amino acids that come from your gastric juices. Well, they found out what a healing property that it had for gut health and other healths. Well, then Big Pharma wants to do their INDs, so the FDA just out of the blue said, oh, bingo, here's, say, 10 peptides that are now on the list.
BBC was on that list.
And that was on it, and it was like, how did this happen? Well, they got sued, the FDA is, and then the people that sued them said, you need to have data to put this on the dangerous list. They had no data.
Yeah.
They were just told by Big Pharma, we're doing INDs and we want to make a product out of it. Meanwhile, why would it be dangerous? Your body produces it.
Now, BPC has switched over to PDA. I forget the abbreviation, it's like pendeca acetate or something along those lines. I can't remember the exact abbreviation for it. So if you want BPC, ask for PDA.
There you go.
But no, it's crazy how much leeway and control that they have over things that are going to help people. I mean, that's a whole different topic for a whole nother day. You can go down that rabbit hole.
That's
you know, and then you look at these young kids vaping.
Yeah.
You know, and you look at it and you go, where's the FDA here? And evidently it's like, when they vape, evidently it's equivalent to maybe the nicotine to 10 packs of cigarettes a day. And then when these kids get off it or want to get off it, their
lungs are shot.
Well, but on top of that, their anxiety goes through the roof.
Yeah.
I mean, I hear a lot of these young kids that are in college and then they want to get off it, and it's like, because they can't focus anymore and their grades go to heck. And and it's like, it's a shame. But I'm very excited, and that's why I'm in this field, and I want to stay, because we're getting there, I think, with Robert Kennedy. Hopefully we'll head up and be in charge of the FDA, that we'll be able to fast track some of these companies in the approval. Matter of fact, when you get through your first IND through stage 1 and you're approved to the second, I believe it's in the FDA bylaws where they really should give you FDA approval. And they haven't been that way with regenerative companies. They want to say, oh, you got to go through stage 4.
Yeah.
I have no clue why, but I basically see a similarity to the way they treated regenerative medicine companies to how the FDA treated the cementless implants in the middle 80s. You know, even like your pedicle screw. It would, right on every box, it would say, not FDA approved for use in the pedicle. Meanwhile, that's the only place that screw could be used.
Right.
And they put it there. And same thing with cementless hip and knee implants. In order to do cementless, you'd have to have a tight fit, a press fit. So there wouldn't be any way you could cement it, the product. It was meant for cementless use on every box. Not FDA approved for cementless use. Well, the joke of that is, every doctor doing it, once he decides that's in the best interest of the patient, then bingo, they can go ahead and put it in cementless. If it's a younger patient, you want to do that. Healthy bone, you want to go cementless. Older patient, not so much. And so, but if they're active, you might consider it. Yeah. But that takes me back to my orthopedic days, and I think that there's a very similarity to the stage where we're at with regenerative medicine, and I do think you're going to see companies, even like the Chimeras out there, that are doing the INDs, and they're doing it the right way. So I do think that you'll see them very much working with the FDA to, and really they have got it right, to really get everything right from their FDA approvals, because that's what they want, you know.
Sure.
Think about whenever, I mean, you were an orthopedic rep and now you're exosome/stem cell rep. Think about if you had a combination of both, how crazy
Seamless,
and that would be. And it's like such like something that would be so beneficial for the patient. Say they get a knee replacement and you do an injection or an infusion of
complementary.
Yep, with it, and how little downtime they would probably have compared to just a regular knee replacement. You come and go, but I bet you that not anywhere near cutting it in half. I bet you maybe you could take a month or so off the original downtime, just due to the infusion or the injection the day of the surgery.
And we see this on topical with burn patients and everything else.
Oh, yeah.
We're seeing it, they're not scarring. They're healing quicker. We're seeing people going in for aesthetics with topical, and they put it on topically for them.
The topical
Tattoos.
is crazy.
And they
was talking about the topical.
they lose the redness right away, like the Vive product for Chimera. They'll put that on topically post laser. They'll put it on. They'll microneedle it in. They'll do the same thing for the hair, and then they'll put it on. Post microneedling, and the patients do fantastic. They can take a bottle home and put it on for the next 2 days while they still have inflammation, but literally their pain is much less and it goes away. So the reason why I talk about topically, just think about the inflammation that it'll do internally.
Absolutely.
Right, like how much more?
Exactly. It's going to go after all areas because it goes after the inflammation. Sure. And I will tell you, people don't realize the harm in these orthopods. They don't make much money. Matter of fact, some probably lose money by injecting the cortisone. There are different types, but they're killing their cells.
Yep.
It's not going to address going after fixing the problem at all. There's not any regenerative, anything in regenerative activity in a cortisone shot. Matter of fact, it's going to do the worst.
Deteriorating.
It's going to kill your cells, and if you do enough of them, you'll actually see where the soft tissue becomes very brittle.
Yep, exactly. You're noticing more people that. I think the sweet spot for cortisone, I think it's 3 injections is like the limit. That's like the absolute limit you should have in your life.
Right.
And some of these places are busting out 3 a month,
Yeah.
if not more, and it's just like, why are you going down that route when you could get one treatment here or any stem cell clinic?
Unfortunately, this field right now is for the people that have money. And honestly, that really, I just don't know why we just can't be more sympathetic for the folks that don't. But that's where it is, and why people go for cortisone is because their insurance will pay it, or they'll put the hyaluronic acid in their knee. And what happens? That gives them a lubricant in their knee for a while. It's not going to produce any synovial fluid, but it'll give them a feeling like synovial fluid, because even in joints, back in the 60s, if you were an athlete and you were to tear your meniscus, they would remove it.
Yeah.
And so, but as long as you had synovial fluid, that was the lubricant, you could go back in and play. Well, what happens is when you get older, you don't produce that synovial fluid. So now you're just bone on bone, and it's a painful situation.
You see a lot of bone on bone with people in your age group as well right now. Like, it's very, very common thing. I don't know if it's going to be a shift with our generation as much. It'll be interesting to see. But no, my mother, bone on bone, almost in both knees. Her siblings, bone on bone in their knees. I mean, it could be a little bit of a hereditary thing because now I have bad knees too. So it's different. It's scary.
We're Christian. Where we want to get though is when someone gets bone on bone and they're grinding like that, they're total joint candidates.
Yes.
And what we want to do is get there beforehand. And I'll tell you, I'm sitting here bent leg right now. I wouldn't have been able to do this. When I'd fly in a plane, and in orthopedics they call it the movie leg, where you can't sit for 2 hours. I couldn't even sit for, I'll say, on a plane for 30, and I'd be rubbing my knee, and I'd be in this one too, and it was right here. I'd get this pain.
Yep.
Ever since I started doing the exosomes, I don't get that. I can sit here, and the same thing in my back. When I'd sit in a soft chair like this, I'd have to get up, and I used to have the sciatic pain where I'd sit on a tissue. Now, granted, I did some exercise, stretching and all that, and to get rid of it.
Sure.
But I did also with the exosomes, and they went after the inflammation, and I was stretching it out.
That's awesome.
So the combination worked, and I'm just living proof of it. So I'm glad to be doing what I'm doing. Like I say, I wish the FDA comes along further so we can get these products approved, and insurance companies can help out paying for it. I mean,
hopefully RFK can get that kind of show going. And I mean, have you seen him without a shirt on? He is jacked. I mean, his voice makes him sound like he's a million years old. I mean, I know he has a neurological disorder, but him without a shirt on, and how like fit he is, it's insane for his age. So I mean, if there's someone that's going to take us to the next level, I mean, I'm sure he works alongside with someone like Gary Brecka, like you said, who's been working with people like Dana White and Tony Robbins guy, people like that. I mean, those are the people that need to be leading this industry and getting the word out about stem cells, about hyperbaric, ozone, different types of, I mean, all the food out that you can buy at the grocery store is junk.
Yeah.
And I mean,
even the good stuff.
Juliana is the foodie here, so she can talk a little bit more about how there's so much garbage in the food. I mean, you're organic, grass-fed beef person.
Well, it's not even. I mean, let's forget about the processed stuff. I mean, even when you're talking about just produce, dairy, meat, like when you're trying to eat healthy, whole foods. I mean, we have to supplement in America because they don't turn over the soil like they do, in other countries. And almost all my clients have to supplement because you don't know you're getting enough vitamins and minerals. We should be able to get enough vitamins and minerals from our diets, like from whole foods, but the quality in America's
tough. And on that, even the nitrogen water.
Yeah.
I've noticed a big difference, and I have a friend in California, and so I never did drink enough water because I'm an iced tea person, but I would, and I always put hydration in.
Turner's iced tea?
Not Turner. Actually, I don't mind them from back in Pittsburgh.
Yeah,
but
Rick and I are Pittsburgh boys, so we there's some little things out there that we know about. Turner's. I played ice hockey with a Turner child, and their family makes killer iced tea. So
their unsweetened is good. They sell it in the 7-Elevens up there.
Oh yeah.
So
that northeast area.
So I'd get some when I'm driving, but no. But I've tried this nitrogen water, and when you do it, it does make a difference. And supposedly you'll absorb your vitamins better. You'll absorb your medicines better by doing it. So
do you have a machine for it? Or
I have a little one I have in my car.
Okay.
That I can go to a store and pour it in. I also have a pitcher at home. I just really started getting into it, but I noticed a difference yesterday when I had 4 glasses. Most of the time I'll do 1 glass, but what I have noticed is I don't get leg cramps at night. I used to get bad leg cramps in bed at night, and they were painful. And I since I started doing it, I'm not getting it.
Wow.
So there's different things that we can. Who would have thought? But
Right. Well, I mean, Rick, you gave us great insight and some great information to think about and let our listeners know what's out there and what's to come with stem cells and exosomes, and where they can find us. I'll let you guys know. You can find us at our number at 561-532-7743. That's our main number. My number is 561-650-4183. The email is info@pbstemcell.com or christian@pbstemcell.com. Rick and Juliana, thank you guys for coming
Thank you,
on.
Christian. I would like to say one last
absolutely.
thing. If you have folks out there, if you ever go to a clinic and they say, this is the way to do it, or a guy wants to do adipose or bone marrow, this is the way to do it, or we have this one product, do not go to that person. There isn't one size fits all. The nice thing about what these folks do here is they'll evaluate your problem, and they'll even though I'm involved in it, they will actually give you what they think is going to give you the best chance of getting better.
Yeah.
And it is tailored, you're correct. And that's what you have to do because, like I say, there isn't, especially in healthcare, when you're going in for an implant, there isn't one implant that fits everyone, and there isn't one treatment when you come into regenerative medicine that fits everybody.
Absolutely. Wow. Well, that was definitely a great way to end that. Yeah. Thank you, guys. Thanks, Rick.
Thank you.
Thank you, Juliana.
Thank you.
That was a good one.
Thank you, guys.
Thanks for listening.